primary survey is two words that we use to describe what do we do in a first aid situation. What are the steps that we follow? What do we do first? What do we do next?
I figured Caitlin would be here soon, so I thought I'd come see if there was anything I could do to help.
Aren't you sweet? How about getting the Parmesan out of the fridge for me?
Sure. So, do we have any Parmesan?
It's in the door.
Should I add this to the sauce?
Yes, please. Just turn the heat down or we'll have a big mess.
That was easy, so is there anything else I can do to help?
You could get the olive oil out of the cupboard
Sure. Where?
above the fridge.
Hi, Mom. Hi, Dad.
Hi, Caitlin. We're in the kitchen.
Kenneth!
Mom! Dad! Most slips and falls are predictable and avoidable, but they're the leading cause of trips to the emergency room. What is the first step in an emergency? A. Call EMS 911. B. Check the scene and the person. C. Care for the injured person. D. Finish making the salad.
So it depends how hungry you are, right? You might check Steve? No. What's the first thing that Caitlin should do?
Check this wrong here.
Should check 911, call 911, check the scene, care for the injured person, and this is exactly what I'm talking about. Something happens and all of a sudden, what do I do first, right? So I've heard a couple of answers. What do you suppose might happen if we just go ahead and call 911? Or they could be fine and
they're alert oriented.
okay, so we could make that call and it's not really necessary, and we can't give EMS any information, right? Okay, how about caring for the injured person? How about we just rush in there and we give them some care?
Probably get hurt yourself.
You could get hurt yourself. What happened with the wife?
Yeah.
Did she do this?
Yeah.
Did she go straight into this, right, and provided care? Okay, let's take a look at the call 911 video section though to see what happens, okay? If you can hit the lights. Just to really reinforce this. So
Dad! Obviously not the best choice. We now have 3 potentially injured people. Let's rewind and select another option. Remember the steps of a primary survey.
I understand we need to check the scene to make sure it's safe. What else do we need to check the scene for?
How much if it's oil, like how much area is covering?
How much area it's covering, what kind of dangers. You know what I'm gonna do? I'm actually gonna click on B, and I want you to take a look at what does Caitlin look at when she checks the scene. So we check the scene and we check the person.
Hang on, I'll come around from the other side. Mom, what happened? No, don't move. Tell me where you're hurt.
Check your father. Is he conscious?
Dad, are you okay? Mom, what happened? Well, how far did he fall?
He was getting the oil out of the cupboard and hit his head on the fridge.
Dad, are you okay? Talk to me. Oh no, he's not fully conscious. The father is not responding to questions. He is only moaning and groaning. What should the first aider do next? A. Check the person from head to toe. B. Check the ABCs. C. Run next door and call for help. D. Call EMS or 911.
What did Caitlin see when she was checking the scene? What are some of the things that she saw? She saw the glass. Yep, what else? The stool. What else did she see?
Her mom.
Her mom, who is injured, right? And her dad, who is also injured. Okay, so let's take a look. Now we know that the glass and the oil, that's significant because it represents a danger, something we could slip on or she could slip on and get hurt. We understand that. What's the significance of looking at mom and dad? Right?
Make sure like they are okay, like if they need how much mental attention they need?
How much medical attention do they need? Absolutely. So there's 2 people that are hurt and 1 first aider, right? How does she decide who to go to? She goes to help dad first. Why does she help dad first? He's not fully conscious, right? So he is in a more serious or more life-threatening situation. So something we need to know is how many people are hurt? How many people need our assistance? That's important to know. Now, mom is sitting up, she's talking, she's breathing, so she's not in a life-threatening situation. She has an injury. Can she be used as a bystander? Could we get her to help us with anything? Is there something she can help with?
She can make a phone call.
She can make the phone call, absolutely. So when we're looking at the scene, we also want to know who can help us. What kind of bystanders do we have around and available to help us with the job we need to do? And then there's that stool laying there. What's the significance of the stool? Let me ask you this. What if you walked into the kitchen, you saw dad lying there and the stool knocked over and mom's not there to tell us what happened?
What tells you the placement of the fall and the proximity of how far he fell?
Yeah, the placement and the proximity of the fall, how far did he fall from, and basically what happened. It's something that we call the mechanism of injury. It helps us to kind of establish what happened. Whereas if you just saw him laying there and there's nothing that indicates to us, we don't have a clue what's happened. Maybe he passed out, maybe he fainted, right? So it helps us to understand better the nature of his injury, right? So when we check the scene, we want to check everything, all of these things, so that we have a full picture. And it kind of took some time for her to look around, but as first aiders, when we walk in, it should happen like that. We're taking in as much information as we possibly can. Okay, so when we check the scene, we check for all those things. When we check the person, the things that we want to check for is level of consciousness and ABC. What does ABC stand for? Airway, breathing, circulation. Okay, ABCs. So the question that was asked was, the father's not fully conscious. He's only moaning and groaning. What should the first aider do next? So what should the first aider do next? Should she check him from head to toe? Check the ABCs? Run next door and call for help, or call 911? What do you think we should do?
Check the ABCs.
Check the ABCs, call 911, right? There's a couple of things going on. And I didn't I just say, check the ABCs, right? But listen to the question one more time. The father's not fully conscious. He's only moaning and groaning. What should the first aider do next? Call 911, because if he's moaning and groaning, what do we know?
You can breathe.
He's breathing. If somebody's moaning, groaning, singing, laughing, sneezing, reciting poetry, is their airway open? Are they breathing? Right? And if their airway's open and they're breathing, then their heart is beating. He's not fully conscious, but his ABCs are good. So what do we need to do? Call 911, right? So when we look at these 4 items, level of consciousness, airway, breathing, circulation, if there's something wrong with any one of those things, it's life-threatening. It has the potential to be life-threatening. And so our next step, the next thing that we're going to want to do is call 911 or EMS. What does EMS stand for? Emergency Medical Services, that's right. Okay, so what we're going to do next is call 911.
Mom, you call 911. I'll look after Dad. Tell them that he's not answering my questions. Dad. Dad.
Yes, I need an ambulance. My husband's fallen off a stool and hit his head.
He's moaning, which means he's breathing. Tell them that.
Yes, he's conscious, but my daughter says he's not responding to her questions. No, he's not alert.
Mom, tell them that there's bleeding coming from the side of his head.
Yes, he's losing a lot of blood.
The father has suffered from a head injury. He is bleeding from the head. What should the first aider do next? A. Straighten and immobilize the head. B. Apply direct pressure to the wound. C. Open the airway and check for breathing. D. Roll the father into the recovery position in case he vomits.
Okay, so what should the first aider do next? Should she straighten out his head and immobilize